I would like to invite on stage Dr.P. Ranganathan, HOD Neurosurgery, Aster Prime. Can we welcome Dr.P. Ranganathan with a resounding round of applause? Very warm welcome to you, sir.
So now the topic is neurosurgeon లో గతంలో ఎలా ఉండేది, ఇప్పుడు ఎలా ఉంది, అండ్ ఫ్యూచర్లోని ఎలాంటి టెక్నాలజీస్ మనకి అందుబాటులోకి వచ్చే అవకాశం ఉంటుంది. ఇది చాలా ఇంట్రెస్టింగ్ టాపిక్ ఐ థింక్. సో దీనిపైన మనకి పూర్తి ఎక్స్ప్లెనేషన్ ఇచ్చేందుకు మనతో పాటు ఉన్నారు డాక్టర్ రంగనాథం గారు, న్యూరో సర్జన్, చాలా ఎక్స్పీరియన్స్డ్ డాక్టర్. సార్ హలో. సో సార్, మీరు చాలా సంవత్సరాల నుంచి ఈ న్యూరో సర్జన్లో ఉన్నారు. సో ఎంతోమంది పేషెంట్స్ని మీరు చూశారు. సో యాక్చువల్లీ పాస్ట్లోని అసలు ఈ న్యూరో సర్జన్లోని ఎలాంటి పరిస్థితులు ఉండేవి?
టాపిక్ స్టార్ట్ చేసే ముందు ఐఎమ్ సీయింగ్ సో మెనీ యంగ్ ఫేసెస్.
ఎస్.
సో లెట్ మీ సే a small prayer. I hope all of you understand Telugu. Right. This is called Sri Rama Shloka. And it goes like this. Apadapamahattaram dataram sarva sampada. Lokabhiramam Sri Ramam bhuyo bhuyo namamiham. I'll translate for you. And the saying is that కష్టాల నుంచి గట్టెక్కించి, whenever you're in trouble, the Lord saves you. And whenever you're in problems, He brings you out. So He again does the same thing for all the people assembled you for a very bright future and a bright career. So this is the summary of the prayer. Many of the meetings which I addressed in the last 42 years, let me speak something about the specialty which has made me whatever I am. And that was in the 1982 Delhi AIMS. I did neurosurgery. And the course was 5-year course after MBBS, direct course. Not to boast, but the seat was 1 seat per year. And I was lucky to get it. Rather than I say I'm great. So for all the young ones who are going to be great doctors in future, let me advertise a few minutes of your time for the specialty what I've been practicing for the last 42 years. Now, neurosurgery పాతకాలంలో అంటే చాలా జోకీగా ఉండేది. Many of you may not know it. 82 ఎయిమ్స్లో నాకు సీట్ వచ్చిన తర్వాత ఐఎమ్ స్టూడెంట్ ఆఫ్ MBBS ఫ్రమ్ వైజాగ్ AMC. అక్కడ మాకు ఒక ప్రొఫెసర్ ఉండేవారు, సీనియర్ సర్జన్, గ్రేట్ మ్యాన్. I was very happy. I went to him, sir, I got the seat. I sent a telegram, no mobile phone those days. He said, okay, I didn't like it. అరే నీకు న్యూరోసర్జరీ వచ్చిందా? న్యూరోసర్జరీ రిజల్ట్స్ బాగాలేవయ్యా, బాగాలేవు. ఎందుకంటే సర్జరీ చేస్తావు నువ్వు 8 గంటలు 10 గంటలు, పేషెంట్లు మంచిగా గారు. I was sad. And he also said something more, that ఏదైనా కార్డియక్ సర్జరీ చేస్తే చాలా యూ హావ్ బీన్ గుడ్, యూ నో. ఐఎమ్ సీయింగ్ ఎ సర్దార్ బాయ్, ఐఎమ్ టాకింగ్ టు ఇంగ్లీష్ intentionally. If you had done a cardiac surgery, you would have been great, yeah. And he gave an example, good one. Suppose somebody has a pericardial effusion. You do a small paracentesis. That's it. The snake goes off. And probably he has truth, because the saying is, చాలా మంది పేషెంట్లు వచ్చి సర్జరీ చేయించుకోవాలంటే 82లో పేషెంట్ నడుచుకొని వెళ్తాడు, వచ్చేటప్పుడు మాత్రం వేరేగా వస్తాడు అని. You know what I mean? Yes. He goes walking, but he comes out as a dead body. After all the efforts by the surgeons, anesthetists, sisters, hours together. Partially correct in those days. Neurosurgery has changed today. Much better. A cardiac surgery సార్ అన్న తర్వాత అదే నాకు ప్రేరణ అయింది. God has been very kind to me all the while. I take the name of God because that helps you. Whichever you believe, that's up to you. It really helps you. I'm telling you with experience. Now I'm 70. Probably of all the panel members since morning you have been seeing, from the, I don't say oldest, but I'm little older. And I'm still operating every day. So I take his name, thanks to God. My son did cardiac surgery, let me tell you, ladies and gentlemen, from AIMS Delhi again. So what more proof I want that the God is there and has been helping the family. So my great teacher, thank you. My great teacher's prophecy has come true to me. So I feel very happy. Okay, I did neurosurgery, but my son is cardiac surgeon. He is aspiring to do some high-fi cardiac surgeries and all. That's apart. Because neurosurgery, a little bit of history. The investigative process was very, very tedious. For example, you have a suspicion there is a head injury. This patient is sick. You know, the CT scan was not there. I'm talking about 82. 82, AIMS was lucky enough. I'm talking about the rest of India. Because the CT scan has come in 1971 in the world. And AIMS Delhi was one of the first in India to get the CT scan installed in 1978. So that's a great opportunity. So the investigative modalities are putting a needle in the neck in the carotid artery. Hope you, all of you know it. Third year you pass it through. I think so. No? Acha. There is a carotid artery in the neck. And there is a large artery which supplies the brain. And whenever you have an investigative modality, one of the doubts is there is something in the brain. And for that, you have to go with, suppose the left side is problem, the patient is not moving, you do a test on the right side. You have a right side, there is a problem, you do on the test left side. That's it. And of course, the pupils, you will come to know as you are growing more number of years. So putting a needle called angiogram, carotid angiogram, very painful to the person who is doing it and to the patient who is getting subjected to, as well as the attendants, imagine. Hours together, patient moves, tying, holding him, very tedious job. But great surgeons were doing neurosurgery also at that time. I respect all of them, ladies and gentlemen. Respective teachers always. And then another used to be there making a hole on the skull bone. Skull bone as such is very tough, you know. And injecting the contrast into the ventricles. The ventricles are in the deepest part of the brain, which contains CSF, cerebrospinal fluid. My goodness. And that investigation, patient used to throw a fit on the table. And after that patient doesn't wake up, it's a very tedious procedure and a dangerous procedure too. And neurosurgery has evolved from that. The great invention is called revolution. Swarnayugam adi, Telugulo cheptanu nenu. Neurosurgeryki Swarnayugam. 71lo edaithe CT scan vachindho, it's called Godfrey Evans. He's not a doctor. He's an engineer. He invented, British man. And CT scan వచ్చిన తర్వాత 1979, there was a radiologist sadly associated with him, Ambrose. But the Nobel Prize was given to Hounsfield. Ambrose was a very sad man. And then, of course, the things have started moving very fast, believe me. 71 CT scan, MRI 77, then, of course, the PET scan has come, then neurosurgery is different. Today, the neurosurgery of today is like that. And more armamentarium, lot of gadgets have come. అంటే కొంచెం చాలా ఎక్విప్మెంట్ వచ్చాయి. ఒకప్పుడు సర్జరీ ఏదన్నా మెనింజోమా బ్రెయిన్లో ఉంటుంది, నాన్ మెలిగ్నెంట్ ట్యూమర్, 7 hours, 8 hours, 10 hours. Now the duration has come down significantly to 5 hours.
అంటే అప్పట్లో న్యూరో సర్జరీ చేయించుకోవాలి అని అనుకునేటప్పుడు సో పేషెంట్స్ ఎలా వాళ్ళ రియాక్షన్ ఎలా ఉండేది, వాళ్ళ అభిప్రాయం ఎలా ఉండేది?
చాలా పెసిమిస్టిక్. అంటే పేషెంట్ అడగలేని పరిస్థితి, కానీ అటెండెన్స్ అడుగుతారు. సార్ మా చలిసిన వాళ్ళు కాలు చేయి పడిపోయింది, ఇంతవరకు ఇంప్రూవ్ కాలేదు, మాట ఇప్పుడుకి రాలేదు, అసలు మళ్ళీ డ్యూటీకి వెళ్ళటం లేదు సార్ ఆపరేషన్ అయిన తర్వాత. ఇలాంటి థింకింగ్ అది. ముందు చెప్పినట్టుగానే నడుచుకొని వస్తాడు, వెళ్తే శవం బయటకు వస్తుందని. ఇంకా క్రూడ్గా చెప్పాలంటే, సారీ టు సే దాట్, బట్ దాట్ వాజ్ ద సినారియో, దట్ వాజ్ ద థింకింగ్. బట్ న్యూరోసర్జరీ హెస్ లీప్స్ అండ్ బౌండ్స్ చేంజ్ టుడే. సో ఇప్పుడు ఏదైతే
ఇప్పుడు ఎలాంటి ఫెసిలిటీస్ వచ్చాయి
అదే చెప్తున్నాను నేను. ఒకటి సిటీ స్కాన్తో 5 minutes, ఇప్పుడున్న సిటీ స్కాన్లో మేబీ 4 minutes. పేషెంట్కి ఏదో బ్రెయిన్ ట్యూమర్ ఉంది, సస్పెషన్, పేషెంట్ గోస్ ఇన్ సైడ్ ది కన్సోల్, 3 minutesలో వీ నో వేర్ ద ట్యూమర్ ఈస్, రైట్? హౌ మచ్ టైమ్ సేవ్డ్. ఆ తర్వాత ప్లానింగ్ వెరీ ఈజీ. సర్జరీ టైంలో దెర్ ఇస్ వాట్ ఇస్ కాల్డ్ న్యూరో నావిగేషన్. Same, a stereotactic, that is without the frame, a stereotactic, very precisely inside the operation theater, a computer engineer is available, guiding us how far from the skull bone, how depth in the brain, how important away from the crucial areas. So navigation. And navigation has told where is the tumor. Now you have to remove the tumor. Now the thing has called microscope as a phenomenal revolution. Now you can see things like threads, 10 times, 15 times, depending upon the microscope. So you will don't do a mistake. Earlier, neurosurgeon was not at fault. There's a facility at fault. So that is the reason. So the ease with which we are doing it, we are lucky, I'm telling you. And you are going to be much luckier, I'm telling you. At the end of the time, you can ask me a few questions, but definitely I will advertise, as I said, my specialty. A large number of them should be neurosurgeons. They require you. The country requires you. The world requires you. And you will not regret, I promise. You can be cardiac surgeon, that's a different issue. But I advertise for neurosurgery. Then the CUSA, that's called Cavitron ultrasonic surgical aspirator. You know, they sucks out the tumor. You will feel fascinated to see that. No more handling the tumor piece by piece, time by time, bleeding. Ours, all is past history now. So the navigation, the CUSA has made life so precise. No more objective. It's all objective now. Earlier it is subjective. Probably the tumor is here. So you keep on digging the normal brain, you feel very bad, very sad. But now we know exactly, and now, even now the patients keep on asking, Doctor, ekkada operation chestar tala meeda ani? Anta brain anta open chestara, like abdomen, chest? No, not anymore. Navigation will guide us, ekkadundi, precise, midline nunchi anta, coronal suture nunchi anta. And we make a small incision there. And many neurosurgeons, they don't even shave the hair. Just a little bit of the hair precisely. So cosmetically is also attended to. Incision is very small. Time is saved. Bone, skull bone మేము చేసినప్పుడు పాతకాలంలో 82లో ఒక్క హోల్ చేయాలంటే is about 40 minutes, 30 minutes effort after good breakfast. Brain flap రైజ్ చేయాలంటే skull bone 4-5 holes, బర్ హోల్స్ అనేవాళ్ళం. ఇప్పుడు డ్రిల్ వచ్చింది 2 minutes. So things are so easy. So precisely దానివల్ల డ్యూరేషన్ తగ్గిపోయింది, the bleeding has come down, the risk has come down, the patient recovery is very good. Definitely acknowledge my colleagues, neuroanesthesia. There is a specialty called neuroanesthesia now. There's a DM course, hope all of you know it, neuroanesthesia exclusive. So the anesthesia has also improved leaps and bounds. So patient wakes up on the table. ఇది ఇంతకుముందు చాలా క్వశ్చన్, టేబుల్ మాట్లాడతాడా, ఇప్పుడు మాట్లాడతా సార్ మా చుట్టం అని. Now they speak on the table. What a fascinating thing. Don't you feel that of the effort of 6 hours, 7 hours, patient is so happy they ask where the attendants are. Patients are getting discharged 3 days, 4 days, no more 1 week, 10 days, ventilator. It's not magic. It's the science called neuroscience today. Now few words about the future.
అంటే ఇప్పటి వరకు మీరు చాలా పేషెంట్స్ని చూసి ఉన్నారు కదా, సో మీ దగ్గరకు వచ్చే పేషెంట్స్ని బట్టి మీకు ఏం అర్థమవుతుంది, ఇంకా వాళ్ళకి బ్రెయిన్కి సంబంధించినటువంటి డిసీజెస్ పైన ఎంతవరకు అవగాహన ఉందని మీకు అనిపిస్తుంది?
అవగాహన ఇంకా ఇలాంటి మీరు కాన్క్లేవ్స్ వల్ల బెటర్ అవుతుందని అనుకుంటున్నాను. డాక్టర్స్ అందరూ దే స్ప్రెడ్ ద మెసేజ్, దే ఆర్ ద ఫ్యూచర్. ఎందుకంటే ఇంకా ఆ బ్రెయిన్ ట్యూమర్ మీద మేము చదువుకున్నప్పుడు ఏమిటంటే, ఇండియాలో బ్రెయిన్ ట్యూమర్స్ అంటే ఒక పెద్ద బాల్ సైజ్ ట్యూమర్స్ ఐడెంటిఫై అవుతాం. ఎక్కడో అమెరికాలో, ఇంగ్లాండ్లో చిన్న పీ సైజ్ ఉండేది అని. నౌ వీఆర్ డయాగ్నోస్ ఎవ్రీథింగ్. Hyderabad, the Bhaginagar city, is lucky enough to have all the infrastructure what is available in Washington DC or London. Tell me. The moment you get in somewhere in America, you are getting in the US, in Hyderabad. So everything is available. The brain drain, the patient drain from Hyderabad or Andhra to other places has come down drastically. The reverse brain drain now. Patients from all the countries, Somalia, Tanzania, all, you take Nigeria, or even from that matter, few of the patients from USA. It's not exaggeration, it's fine, because the cost is still less. So it's attractive to the patients. So you have the infrastructure, you have the facility, the ability. The ability is no less than anybody across the world. So the patients are trusting us, the attendants are trusting us today.
సో రోబోటిక్ సర్జరీస్ కూడా వచ్చాయి అని విన్నాం. సో దానివల్ల ఎలాంటి యూజ్ ఉంటుంది మనకి? ఏం
That is the future. Neurosurgery, particularly 2024, is a magic year. You must have heard Elon Musk. Have you heard of Elon Musk? Yes, he's a very cranky guy, doesn't matter, but a very bright guy. One of the very, very rich person in the world. You know, the star, SpaceX and all that. January, there is a great revolution idea from him. That's why I said cranky guy. What is called a Neuralink startup he has started. Neuralink. Brain lo oka chip పెట్టాడు. A fellow was after the accident was not able to move the hands and the legs, and he could move a cursor of the computer with some idea. He wants coffee. He wants to put a message. He can't move the hands, right? So now with the idea what his brain is functioning well, luckily. With that he could move the cursor, I want coffee. People are getting coffee. What a fascination thing. So this Neuralink has come out with a brain chip in January. And 2 months ago, there is again a fascinating thing called head change, transplantation. పాతకాలంలో సినిమాల్లో ఎక్కడో ఫ్యాసినేటింగ్గా ఉండేది, ఏదేదో ముందు ముందు వస్తుందో ఏంటో అని. తల మార్పిడి, ఎస్, ఈస్ గోయింగ్ టు కమ్. అండ్ ఎ ఫెలో బై నేమ్, ఇట్ ఈస్ అగైన్ అ స్టార్ట్అప్ బై ద నేమ్ బ్రెయిన్ బ్రిడ్జ్. అండ్ ఎ జెంటిల్మన్ బై నేమ్ హష్మి అల్ గలీ. With the use of the artificial intelligence today, everybody talks of artificial intelligence. So they have transplanted with a super active robots with no time, because the common feeling has been the brain gets damaged in no time. And we were taught that 4 minutes hypoxia, patients get brain damaged. Now taking all those scientific factors, preservation of the brain, there are a lot of new solutions. So within the next 5 years, ladies and gentlemen, people who have a cancer in the brain, or patients who have Parkinson or Alzheimer's disease, which there is no cure yet, there is a possibility, not possibility, a feasibility of a head being transplanted shortly. And another important thing has come, that is, I was fascinated with this. I did a lot of studies and videos in the YouTube. Those who want, you can just go through whenever you have a time. Recently, I did a video. By 2045, the artificial intelligence is assimilating with the human intelligence. You know how is going to be 1 billion times the human intelligence is going to multiply. You can do anything, anything. For example, he says by 2045, there may not be deaths because of the natural causes, like age-related deaths. They're not, no. Why? There are nano robots are coming. You know, nano is 1/10 lakh of a millimeter. What a small thing. And that they are going to travel in the individual's blood, and they carry medicines. Like for example, somebody has a cancer, chemotherapy, radiotherapy. That's what is given now. The nano robo carry the medicine only for the cells of the cancer. It doesn't destroy the other cells. Somebody is getting aged, old man, 70, 80, you want to be young. Now these cells go and travel in the blood and remove all the damaged cells. It's not some hi-fi thing, fiction. It's going to be science. So there is a gentleman again by name Roy Kurwell said, by 2045, the man can change himself. He wants to live longer. The longest living recorded in the world is 125 years. He says for many more years you are going to live. So the fascination of neurosurgery is massive, and definitely it's not that pessimistic when I started 42 years. The fact that for 70 years, I'm just entered 70, I'm still very active, thanks to God, and I'm doing neurosurgery. I want to see the day when 2045, many age-related problems can be handled without leaving our own kith and kin, and very happy ones.
రైట్ సార్, ఫైనల్లీ ఐ వాంట్ టు ఆస్క్ యూ, సో ఈ మెదడు ఆరోగ్యం పైన ఎలాంటి దృష్టి పెట్టాలి అందరూ కూడా?
ఇప్పుడు కూడా ఈ మెదడు ఆరోగ్యం, ది బ్రెయిన్ హెల్త్ ఈజ్ వెరీ ఇంపార్టెంట్. దట్స్ ద థీమ్ ఆఫ్ 2024 బ్రెయిన్ డే. Brain Day we celebrated, I think, 5 days back. And the theme is brain health prevention. Because there are 13.4 billions of neurological diseases in the world every year. 13.4 billions. And 11 lakhs are dying every year. Sad thing, isn't it? So the time has come, and a good number of all these diseases can be prevented. That is, you can't have a control on the brain tumor. That has happened. It happened. It's not anybody's mistake. They like stroke, Alzheimer's disease, all the Parkinson disease. And many of the time now the studies say that they are preventable. So the prevention is going to be the mantra for the future. So once the disease has it, adding to that and all, of course, changing the head and all is going to happen. But how many people can afford? That's the problem. Because two, artificial intelligence machines have to work simultaneously, robots, and then the head has to be transferred. Such a tedious procedure. Till the feasibility of even the common man gets into that, the mantra should be prevention. Prevention is always better than cure. So the neurosurgery tomorrow, or as I say that Munumundu, is going to be a massive explosion. Because of the investigations, every day one new investigation, one new concept is coming. So I see a very bright future to neurosurgery. So I definitely invoke and suggest to most of you, good number of them definitely should do neurosurgery in the future.
Right. Thank you. Thank you so much for joining with us, sir. Thank you.
Right.